I think one of the biggest advances is regenerative medicine. I don't know if you have any comments on this and what you've heard, because it's always good to hear, both sides of the story as to what's sort of the next thing up there, because regenerative medicine is a hot topic and that everyone is talking about it.
Well, I do have a question because I'm hoping that this is something that's going to help me in the future, because I've had issues in the past, and I knock on wood, it hasn't been as bad the last year, but I was getting this injury about every 2 to 3 to 4 months, and that was with my piriformis. And I went to a doctor, and at the time he was like, yeah, man, you've got some arthritis, you've got some injuries, things that piled up over the years. I played this, that, and everything else. And at the time he was like, we got to get to a point where we could get some stem cells and do some things. And, maybe we can help the way you're feeling. Well, I have still not had that treatment yet, so when it comes to something like that, will that be beneficial to me or apply? And if so, what is the timeline that can happen? Because I'm going to make an appointment tomorrow.
So, I think obviously we get into a broad spectrum. So regenerative medicine is the idea, can we find a way with medical technology to regenerate parts of the body or to protect the body?
Yeah.
And from an orthopedic standpoint, it's really important. We're looking for the Holy Grail. We've talked about this before. We are starting to try different stem cells for treatments of, early arthritic changes, but we don't have a lot of data yet. There's fat stem cells, we have stem cells from synovial joints, we have stem cells from amniotic fluid. Again, we're not selling these things right now as an orthopedic group because we're still on the verge of trying to figure them out. They're still in sort of testing phases. Obviously, you got to be careful when people are selling stem cells at, $5,000, $10,000 a pop, telling you it's going to change your life. And so we got to be careful about that. But there are other fields where they're testing it. I mean, multiple sclerosis is a big one. ALS, brain injuries.
Yeah.
A big one for us as orthopedics is the spinal cord injuries. And they're trying to look at the ways that we can find a way to regenerate stem cells to get people back to what they're doing. And can we do that with a combination of other medicines? You've seen these impressive gene splicings options. I just was reading about Duchenne's muscular dystrophy, which is a really horrible disease, or you heard about sickle cell, and they've spliced genes to get people better again. I mean, they're treating all sorts of genes with this sort of regenerative medicine. Awesome. And looking at aging. I mean, not only are we treating diseases or treating injuries, but can we reduce or turn around aging with these things called telomeres, or sort of the end of your chromosomes that sort of, as the longer you have, then maybe you have more time in this planet or not, and finding ways to reduce ways to have those be damaged. And so, I think we're not there yet, but that idea of regenerative medicine is a very hot topic. And I think that this plus AI in the next 10 years is going to be one of the, the cutting edge fields to treat diseases that are really bad and to treat diseases that are not as bad. No offense to your hip arthritis, but obviously it's very important. We want to treat that, but can we also save people's lives? And I think that we're going to see that this stem cell thing, it may not be what we think it is now. We think of stem cells as like, you take some juice out of your body, mix it around and get the new stem cells, or is it something that we have to develop in the lab, with other techniques? Or is there going to be an epiphany where it's designed by computers and computers figure it out? We're getting there, and we're confident. It's one of the hottest fields. Everyone wants to have this. We all want a magic shot. I have patients all the time that ask for this, and we're getting closer each day, but it's just going to take more time. And unfortunately, Will, there's no appointment for you at this point.
Oh,
but as soon as there is, I'll be telling you right away.
Yeah. I mean,